All right. Welcome to our community spotlight. I am Dr. Carolina Tillotson. I'm the owner of the Wellness Connection. I'm also a chiropractor, and I love spotlighting people in our community who are dedicated to helping our community be healthier. Because, as you know, that is my mission. And the goal of the practice is not just to help you physically feel well, but to think well, move well, eat well, and heal well. And today I'm super excited to introduce you to Tyler Tredway. She is a physical therapist specializing in pelvic health, and she's just up the road from the practice. So she's an Atlanta native and has been practicing in Atlanta since she graduated from Emory several years ago. She's a mom of two toddlers. She loves helping women recover from childbirth and get back to doing the things that they love most. And so Tyler, thanks for being spotlighted today.
Thanks so much for having me.
You're welcome. So we're going to just jump into the deep end. I want to know, what is your favorite thing about being a pelvic floor or pelvic health specialist?
I love being a pelvic health specialist because it's really doing a lot to improve people's quality of life. And that's kind of how I got hooked on it, is that, can you hear me, by the way? Your face.
I can hear you. It looks like the video has frozen a little bit. Now
Okay.
it's
Now
good.
it's good. Okay, I'll just keep talking. But yes, so I love it because it can make such a meaningful impact on people's quality of life. I love being a physical therapist in general because we do that with, neck pain, back pain, whatever it is. But there's something about having pelvic floor dysfunction that just really impacts people's quality of life in a way that knee pain or back pain doesn't as much. If people are leaking urine, if people, are having pelvic organ prolapse and feel like they can't do all the things that they were doing before they had a baby or when they were younger, it's really, really huge for people to have someone to address those concerns that they don't even know can be helped with physical therapy. Maybe they think they need surgery or some kind of medication. So the fact that we can really go there with them and give them some tools that they can learn to help themselves with to get back to doing what they want to do without needing to wear pads, without leaking urine, without, having some of these really, really, what's the word I'm looking for? Like, it's very, I have baby brain still, but it's so emotional to have pelvic floor symptoms in a way that it's not to have pain in other body parts, is I think what I'm trying to say.
Sure. And just to give people a background who might not know, you're a physical therapist and you've done extra training, extra specialization to be able to help people with pelvic health, right?
That's correct.
Yeah.
So coming out of PT school, we get a generic overview of, hey, this is your pelvic floor, it exists, and some people specialize in it. In order to really become a pelvic floor specialist, what I had to do was take a lot of continuing education courses after I graduated physical therapy school. And so I started doing that a couple years after I graduated and layering that onto my skill set that I already had as a physical therapist to be able to help people in that way.
I love that. And you're just now getting to meet Tyler over, this Facebook Live, but when you get to meet her in person, it's so easy to see that this is her passion. And I can tell you, as a provider, there's nothing better than being able to, refer and work with other providers who truly have passion about what they do. There's just something that sets them apart. So I love hearing you talk about the pelvic health and how much it changes lives.
Mm-hmm.
Talk to me about, okay, so you specialize in helping women after, recovering postpartum. However, pelvic floor health is not just for women.
That's correct.
Okay. So
Yeah.
who would be a really great person to, like, what sorts of symptoms or signs would they have that would lead them to think, I need to really find a pelvic floor specialist?
Anytime you're leaking any amount of urine, that's pelvic floor physical therapy can help with that. Anytime you're having pelvic pain, so pain anywhere in that lower abdominal, pelvic, tailbone kind of region, that's something that pelvic floor therapists are uniquely qualified to address. Some people have pain with intercourse, both men and women. And having sexual dysfunction, we can help with that. Pelvic floor muscles are really involved in, the sexual response and being able to, be able to enjoy that without pain. So physical therapists can help you with that. A lot of people don't know that PT has that skill set, but a pelvic floor physical therapist can. Any kind of bowel dysfunction, so having constipation, having leakage, unwanted of gas or stool, pelvic physical therapists help a lot with that as well. I would say those are kind of the main red flags that I would look for, the pelvic pain and the issues with urinary and fecal incontinence, but that's not a completely comprehensive list, but those would be the most common things that I would see both a man or a woman for.
Sure. And then because of your specialty and love of working with women in postpartum, what would a woman at that stage in her life like be experiencing where she would need to seek you out?
Mm-hmm. Yeah. So first of all, I think that really every woman who goes through a childbirth experience should be assessed by a pelvic floor, because it's just a lot for your body to go through, even if everything is healing, quote unquote, normally. It's still a lot of tissue adaptation that happens and a lot of recovery that has to happen afterwards. So I think that that guidance can be useful for anyone. But the main things that I would say, definitely get yourself to a pelvic floor therapist is, like, let's say, you got your 6-week all clear from your OB, but you're still leaking urine when you sneeze. You still feel like you can't quite make it to the bathroom. You try to have intercourse for the first time and it's extremely painful. Those are the kind of things that you can go to pelvic floor physical therapists for. So those are the main things that I would be wanting to see someone for. But also if you're just having pain as well, like in the lower back and the hip area, sacroiliac joint, those are also really common things that we can treat in pregnancy and postpartum.
Perfect. Now, do you want someone to wait until they're in pain, or is it more preventative with some of the work that you do?
I love this question. In my ideal world, I would love to see people more preventatively. So anyone who is pregnant can come and see a pelvic floor physical therapist, and we can take a look at your posture, your breathing, how you're moving. We can give you some advice and guidance on how to prevent some issues from happening in the first place. And maybe we can't prevent everything, but we can at least give you some guidance and education so that hey, this is a red flag that I need to, seek out this pelvic floor physical therapist for. And also so people aren't blindsided by the things that can happen with childbirth and delivery. So I love seeing women in their 3rd trimester, and we can just talk through, what happens during labor. What are some strategies for positioning, strategies for pushing? What can you expect in those first few days after you have the baby? And just give them some tips and suggestions for that period where they're not necessarily going to be able to see me, and then knowing how and when to reach back out. So there's a lot of things that we can do, even if you're not having pain. So most people do wait till there's a problem. I love it when people come in more proactively and we can work through some of those issues before they happen. And hopefully we'll be able to prevent some things from happening in the first place.
Absolutely. And you know me, I am of that mindset as well, that if we can get people well and staying well before there's pain or before there's an issue, the results, first off, tend to come faster for people. And then the quality of life stays elevated. And so just know, from a chiropractor and then from Tyler as our pelvic, health specialist there and PT, that it is okay to seek out care and actually encouraged before there is an issue.
Absolutely.
Because things are silent before they speak.
Yes.
So I'm just going to put that plug in there for us. And what's one of the biggest misconceptions people have about what you do?
I would say the number one misconception is that I just teach people how to do kegels, and that is definitely the case.
Yes. Because I hear the same thing. People say, I'm just going to go do kegels. And I'm like, that might not be the answer.
That's true. So there's a few problems with that. One, a lot of people don't even know how to do a Kegel correctly. It's really just an isolated pelvic floor contraction. Two, most people need more than just learning how to contract their pelvic floor in an isolated type of way, because it really works with the rest of your body. And then number 3 is some people really should not be trying to do Kegels at all. Like if you are having a lot of pelvic pain, maybe even if you're having an issue with leakage, it might not be that your pelvic floor is weak. It might be you can't relax your pelvic floor. And so we definitely need to teach you how to do that before you try to start doing a bunch of Kegels on top of that. So yes, I would say that's the number one misconception, and it does not cover what I do exactly.
Sure. And that's just kind of what culture has put out there, that Kegels must be the answer after you have a baby. And it just isn't the case. So what is a piece of advice, or maybe 2 pieces, that you constantly find yourself telling people? that if you were to write a book, it would be your chapter 1 and chapter 2?
Um,
Here's the intro.
So I guess my number one soapbox is really just to take it slow and to have, a realistic time frame of how long things are going to take to get back to normal after childbirth, because I think we really rush women through this and thinking we should just be back to our pre-baby state at 6 weeks, and that's just not the case from a physiological standpoint. So even if you're not having any specific injuries or pelvic floor dysfunction, if your childbirth was non-traumatic, you're still just healing at that phase from a physiological standpoint. So I would say just take things really, really slow for the first, honestly, 12 weeks. So thinking about those first 12 weeks as really building the base of your core, pelvic floor control, working on posture and breathing and mobility, and really not getting back into any kind of high impact activities until more down the line. So definitely after that 12-week mark, if people want sort of a realistic time frame of that. And of course, as a pelvic floor physical therapist, I want that to be, with the guidance of a physical therapist. So go ahead and come into PT before that, and we can help walk you through that progression up to those higher level impact things. But yes, I would say the number one tip I have is patience. And I know that it sounds like a long time if you're a go, go, go type of person. And I'm a runner myself. And so I know in particular, runners don't like to stop running. I hated not running. It's such a big, not just like a physical outlet, but such an emotional and mental health release that it's really hard to not have that. And I get it, but you're going to cause yourself more issues in the long run if you start too early. So it's good to have patience is my number one tip.
Good. What's your chapter 2?
My chapter 2, my chapter 2 is, oh gosh, I would say chapter 2 is don't accept things as your new normal. And if you don't get the relief that you want from one provider, ask somebody else, because I think that too many women just normalize and accept things as like, this is what happens after I have a baby. So people kind of joke about, sneezing and leaking pee, or, oh, I can never get on a trampoline again because I've had a baby. It really doesn't have to be that way. And there's a lot of things that can be done to help. And so I would say just, don't accept things as like, this is the way it's going to be. And there's so many different things that you can try and so many different ways that you can be helped to improve those types of symptoms.
Yeah. And then one thing I hear from people is, oh, I'm just going to have another baby really soon, so I'll wait and do everything after I've had all of my kids.
Oh,
And
yeah.
I know my, clinical advice, but what would you say to that?
Yeah, I would say, go ahead and address it now, because even if you don't get yourself back to 100% where your goal is, doing something is always better than nothing. And I've certainly worked with women, even coming in their third trimester with a second child, saying, I never address this stress urinary incontinence where I'm leaking urine, every time I sneeze or jump. And I know that I'm in my third trimester, I have all this pressure on my bladder right now, but I still want to go ahead and start trying to work on this before the baby comes. And it's never too late to get help, and the earlier the better, obviously, but go ahead and get the help, even if you don't think you have time to reach your full goal based on your plan for your family. And I would never tell anyone to, if this is a fear of someone, that, oh, you shouldn't be, trying for another one right now until we get you back 100%. So I'm always supportive of whatever people's, family plan is. And I'll give advice on how to optimize that, but I'm not going to tell anyone what they should or shouldn't do as far as their child planning.
Sure. And I talk a lot about windows. So there's windows that, we have in our life and in our physiology that when we take them, we can maximize our results.
Mm-hmm.
And so just letting people know, whoever's listening, if you are, have had a child, you want a child, and, there will be a gap between more children, knowing that you don't have to wait and do things in that linear way of,
Mm-hmm.
finish one thing and then start that other, that
That's
the
true.
results that you would get from, care will help you through your other pregnancies. It's not an isolated thing where it's only for you. It will bleed into those other experiences as well.
Mm-hmm. Absolutely.
Yeah. And so so let's talk about you for a second.
Okay.
You're a runner. You just
Mhm.
told us. How else do you take care of yourself?
Well,
Favorite.
now So I'm trying to be better because I was the kind of runner in my early 20s and really up until before I had kids where I would just, if left to my own devices, want to run every single day. And it's really not what your body likes to do. I mean, it's what I like to do mentally, but I had shin splints and I would get some SI joint pain. I had my share of injuries that took me out because of that. And so now that I have had 2 kids and I'm now in my 30s, I feel like I get away with less. And so I now am much more intentional about the way that I take rest days and the way that I cross train for running and work on more mobility exercises and work on strength training in ways that I was very lazy about doing before. But now I know that if I want to continue to run, I need to do these things to support my body in a good way. And then, of course, self-care is not just about, taking care of yourself from a workout standpoint, but actually allowing yourself some time to yourself, making sure you're getting good sleep, making sure you're taking some time to, breathe and meditate. I'm honestly probably not very good at that myself, even though I tell people all the time that they should be doing it themselves. And it's hard though. I mean, I get it. So when I tell moms who are in the thick of it that, hey, you should take some time to yourself and, really, if you're having a lot of pain and if you're having, any kind of issue where we think we just need to relax and down train some things, I understand how hard it is to fit that into your day, to really work on some diaphragmatic breathing, maybe listen to some relaxing music, try to meditate a little bit. So I don't make those recommendations thinking that women have all the time in the world, because I have a 16-month-old and a 3-year-old. And so I try the best that I can to ask people what they're already doing and seeing how I can fit my recommendations into how their lifestyle is already.
Yeah, and again, we go back to windows. There's windows in our physiology and healing, and there's windows in our day and in our seasons. And especially for moms with little ones, the windows can be smaller. And so it doesn't, mean that you have to do everything that we're supposed to do, quote unquote, supposed to do. But maybe doing one thing really well and then building on that and celebrating those wins. Because moms are amazing. They do so much. So where can people find you?
My sound just went out for some reason. So I can't hear what you were saying.
Okay,
right
so all right, okay, you're back.
Question, yes.
Yeah, so where can people find you?
Okay, so I work at Active Core, which is in Druid Hills. We're off of Zonolite Road. So if you know where the intersection of Briarcliff and Clifton is, it's really close to there, close to Emory. So that's where I work. You can also find me on Instagram. I'm at Dr. Tyler Tredway. You can also email me, and it's just tyler.treadway@activecore.com. And Active Core is just spelled like active core, but active does not have the E on it. So email is great. You can find our website, activecore.com, and you can contact us that way. There's a contact form, there's a phone number. So lots of options for how to get in touch with me.
Awesome. I love that. And we'll make sure your information is below the video so that people can reach out if they want to. And sometimes I get the question, why a chiropractor and why a physical therapist, and how do they work well together? And I will tell you, they work well together beautifully, especially if you have the vision of wanting people to get well and stay well, and, be able to, be healthy from within and live their life to their fullest. So in my practice, I see a lot of expectant mothers and postpartum. And so, we work on helping keep that nervous system healthy. And Tyler comes in and is really great at being able to address those symptoms that are outside of that. And so that is kind of how, if you're wondering why a chiropractor and a physical therapist are on the same video, that is why. Because you need your whole body to work well, all the parts.
That's true. I think that there's, people think that we're in competition, PTs and chiropractors, but while our skill sets kind of overlap, there's definitely room for collaboration. And I think that, the more the better. And I think that, we can only help together get better outcomes for our patients. So I appreciate that we align so well with our philosophy on patient care.
Yes, me too. And so stay tuned because we will likely have a workshop coming up soon. It will not be on how to do Kegels, but it will be something else pelvic floor health related, or maybe we will do just a Kegel workshop. Um,
Whatever people want, I'm happy to talk about.
yeah. Um, so stay tuned for that. Tyler, it was an honor and a pleasure to talk to you and let people hear a little bit about you. And I'm excited for to continue to collaborate.
Yes, me too. Thank you so much.
You're welcome.